Today I want to address some misconceptions about chiropractic, and you really want to wait and have a listen to these, because some of these may be things that you have in mind and you believe in. And today I want to clear the air, so to speak. So the first misconception is chiropractic care is not based on science. Now, a lot of people believe the chiropractic care is just made up. And well, let's look at it this way. The body is the body. Anatomy, muscles, skeleton, the nervous system is as it is. So you go to an anatomist and they will show you the muscles. You go to a neurologist, they'll talk about the nerves. You go to an orthopedic consultant, they'll talk about the bones. Well, the chiropractic, what we're doing is we're utilizing all of that knowledge. Now, you cannot tell me that an orthopedic consultant isn't based on science, or a neurologist isn't based on science, or a sort of a muscle specialist isn't based on science. Well, of course it is, right? So what is the difference, right? We as chiropractors use all that knowledge on the human body to help you get the most out of your body, to get it to work to its optimum. So you cannot tell me that chiropractic is not based on science. Now, what you might be thinking about is the way that we treat it. Okay, so you go to a physio and they give you some exercises on how to sort of move a joint, right, or to move a body. Fair enough. But if that joint is not moving to its full range of movement, and I as a chiropractor, right, will find that in the examination, and then I give it what we term an adjustment, which is a movement of a joint, a stretch of a muscle, and we allow that joint to move to its full range of movement. Tell me that's not based on science. Because all we've done is allowed the body to go to its normal range of movement. How is that not science? Okay, so please understand, I did not study for 5 years. I didn't study biochemistry, physiology, anatomy, look at dead bodies, go and explore sort of the muscular structure of dead bodies, cadavers in a Southampton hospital for 5 years and sit through all those exams to be told that what I do is not science-based. That's just madness. Total madness, yeah? It's like telling a GP that they're not doctors. Now, they're only doctors because it's an honorary title, right? A GP isn't like a PhD, which is a doctorate, right, in study. He is given an honorary title of a doctor, just as we, Doctor of Chiropractic, is an honorary title. I haven't got a PhD, but I have got an MSc, a Master of Science in Chiropractic, and I did do a Bachelor of Science in Human Chiropractic. So we study exactly what a GP will study in their first couple of years, which is anatomy, physiology, biochemistry, right? So we study that exactly the same. But what we then do is we go on and we learn how to do our practical aspects, how we actually move the joints, move the body, move the muscles, stretch them to their end range of movement. All right, and then what the GP will do is go and study how to sort of basically perform medicine. Yeah. So please don't tell me that what I have done and what I've learnt is not based on science. Okay, we'll just wait for that phone to stop.